Hello everyone, and welcome back to MediInsights, your go-to channel for unlocking the wonders of wellness. Today, we're diving deep into a critical health topic, esophageal cancer. We'll cover what this disease is, its early warning signs, possible causes, how it's diagnosed, and the treatment options available. Whether you or a loved one is facing this condition, or you just want to learn more, stay tuned as we break down all the essential details. Plus, we'll provide important precautions and expert advice to better understand and manage esophageal cancer. What is esophageal cancer? Esophageal cancer is a type of cancer that forms in the esophagus, the tube that carries food from the throat to the stomach. It falls under the category of gastrointestinal cancers. There are two main types of esophageal cancer, adenocarcinoma and squamous cell carcinoma. Adenocarcinoma usually develops in the cells of the lower esophagus and is often associated with conditions like gastroesophageal reflux disease. On the other hand, squamous cell carcinoma occurs in the flat cells lining the middle and upper parts of the esophagus. Signs and symptoms of esophageal cancer. The early signs of esophageal cancer can be subtle but may include difficulty swallowing, also known as dysphagia. Some people experience unexplained weight loss, chest pain, or discomfort. A persistent cough or hoarseness might also be present. Other common symptoms include indigestion or heartburn that doesn't improve, vomiting, sometimes with blood, and general fatigue. Next, causes of esophageal cancer. While the exact cause of esophageal cancer isn't always clear, several risk factors have been linked to its development. Smoking and excessive alcohol consumption are two major factors. Chronic GERD, which can lead to a condition called Barrett's esophagus, also increases the risk of developing adenocarcinoma. Obesity is another risk factor, as it can contribute to acid reflux and GERD. People over the age of 60 are at higher risk, as well as those with diets low in fruits and vegetables. In some cases, infection with human papillomavirus can be a factor, although this is less common. Additionally, regular consumption of very hot liquids or exposure to certain chemicals can irritate the esophagus, increasing the risk of cancer. Next, diagnosis of esophageal cancer. Diagnosing esophageal cancer involves several tests and is typically carried out by a team of specialists, including gastroenterologists, who focus on diseases of the digestive system, and oncologists, who specialize in cancer treatment. One of the main diagnostic tools is an endoscopy, where a flexible tube with a camera is used to examine the inside of the esophagus for abnormal growths. If suspicious areas are found, a biopsy is performed, where a small tissue sample is taken for analysis. Imaging tests such as CT scans, PET scans, and X-rays help to get a clearer view of the esophagus and surrounding tissues. A barium swallow test, where the patient drinks a liquid that helps outline the esophagus on X-rays, can also be used to detect abnormalities. Next, treatments of esophageal cancer. The treatment for esophageal cancer depends on its stage and type. Surgery is a common option, especially in the early stages, where part or all of the esophagus may be removed in a procedure called esophagectomy. Radiation therapy is another approach, using high-energy rays to target and destroy cancer cells. Chemotherapy, which uses drugs to kill cancer cells, is often combined with radiation or surgery. Targeted therapy is a newer option, focusing on specific genes or proteins in cancer cells to block their growth. For some patients, immunotherapy, which boosts the body's immune system to fight cancer, may be an option, especially in advanced stages. Next, precautions for esophageal cancer. To reduce the risk of esophageal cancer, it's important to avoid smoking and limit alcohol consumption. Maintaining a healthy diet rich in fruits and vegetables can also lower the risk. If you have GERD or other gastrointestinal issues, managing these conditions early can help prevent long-term damage to the esophagus. It's also important to maintain a healthy weight, as obesity is a known risk factor. If you have Barrett's esophagus or other risk factors, regular screening can help detect changes early. Next, advice for this patient. If you've been diagnosed with esophageal cancer, staying informed about your condition and treatment options is crucial. Don't hesitate to seek support from family, friends, or support groups, as emotional and mental health play a big role in your recovery. Eating a healthy diet is important, and if swallowing becomes difficult, soft and nutrient-rich foods can make eating easier. Work closely with your healthcare team, attend regular follow-ups, and stick to your treatment plan to improve your outcomes. Lastly, stay positive. While the journey may be challenging, advances in treatment provide hope for many patients. By the end of this video, we hope you now have a better understanding of esophageal cancer and the steps you can take for early detection, treatment, and prevention. Thank you for watching MediInsights, where we unlock the wonders of wellness together. If you found this video helpful, don't forget to like, share, and subscribe for more health insights. Stay healthy and informed,